Can you run during pregnancy? Hopefully I can answer that question for you today. My name is Kristen Norwick. I'm a pelvic physiotherapist. I have a master's degree in physical therapy and extensive training in pelvic health and pregnancy and postpartum. So if you like to run, you're a runner, and you're wondering if you can run during pregnancy, honestly, the answer is usually yes, but there are a few different things that you should do in order to figure out if it is the right thing for you to do during this pregnancy. So the first thing I always recommend is that you chat with your primary care provider. So this would be your doctor or your midwife, and just ask if they have any concerns with you running. And I think it's really important here to be very clear about what type of running you want to do. How long, how far, how fast, what type of terrain, and also how comfortable you are. So are you wanting to get into running, or are you an incredibly experienced runner that has been running all the way leading up to your pregnancy? Those factors are going to influence what your primary care provider is able to give you in terms of advice, and the more educated they are about your needs and your desires to run and what you want to do, the more they can give you that really accurate information. The second thing that you can do is you can see a pelvic physiotherapist like myself. We have training in assessing your musculoskeletal system, so your muscles, bones, joints, ligaments, and ensuring that everything is working as we want it to when you're running. So oftentimes when I do this assessment, I'm going to be looking at things like how well is your pelvic floor contracting and supporting your pelvis when you're hopping or jogging on the spot, and we'll go through those together to figure out not only are your muscles strong enough and are they good enough at relaxing, but also are they doing what we want them to do in more of that functional movement that mimics running the most. You really want that type of functional assessment to occur. So if you do see someone and they don't do a functional assessment, you can absolutely ask them to, because we are often very receptive to feedback. However, you may want to seek someone who actually goes about the assessment in a way where they actually add in that functional component. So it'll seem like you're doing things that are more similar to running, like practicing standing or balancing or jumping on the spot. You may not progress to that hopping stage because they may find that you're not using your muscles super well just in standing. And that's okay. The progression would be that you learn how to use your muscles sitting, lying down, then standing, then balancing, then hopping, then running. So that's going to look a little bit different depending on the individual physiotherapist you see and where you are at when the assessment happens. Ideally, we're teasing apart how your muscles are functioning in that functional task of running. Ideally, they're working well to support your body, support your pelvis, support your organs, and your pelvic floor muscles are working well, your core is working well, and your legs are working really well. If anything isn't quite where we would want it ideally for running, then that's where a physiotherapist can actually give you exercises to work on to get you to the point where running is okay. So I've absolutely worked with people during pregnancy who at the start of pregnancy, pelvic floor, core, or something in the area wasn't quite doing exactly what we wanted it to do, did some exercises, and then slowly got into running over the course of pregnancy. That is possible, but that really does require an individualized approach because everyone is going to be different in terms of what they need during pregnancy to run. And if you are able to run during pregnancy, it's pretty much the same for everyone. As you get close to the end of pregnancy, usually your body starts to give you some cues that it either doesn't want to run as far or as fast, or it doesn't want to run at all anymore. And usually those cues will come up in the form of pelvic muscle function or pain. So you might notice that your pelvis is sore, your back is sore, your hips are sore, and you're just like, it just doesn't feel like my body wants to keep going. Or it might pop up in terms of bladder function, so you might notice that you start leaking when you're running. Or it could pop up in terms of bowel function, so you might notice your bowel starts leaking when you're running. Those symptoms tell you that your pelvic floor muscles can't quite handle the demands of running anymore, and that's your body's signal to you that it's probably not enjoying running as much at that stage in pregnancy. I've had that happen to my clients relatively early on or way late into the pregnancy. Everyone is very different with this. So watch for those signs and symptoms. You can work with a pelvic physiotherapist who can help you with those, but you can also watch for them, modify what you're doing, modify how far you're going, how fast you're going, that sort of thing, and those symptoms might go away, and then you might be able to keep running at a slightly modified pace or a slightly modified distance. When in doubt, talk to your doctor, talk to your midwife, talk to your pelvic physiotherapist, and make sure that you get quality information from them about your individual needs. If you want to see one of our physiotherapists, we see everyone over video call, so you can book with us via the link in the description of this video. And if you want more learning, I am building a pregnancy course, which should be available soon. And once it is, I'll also put the link in the description of this video. All right, have a great pregnancy.